Bismillahirrahmanirrahim. Our next topic is contagious acne of horses, also known as Canadian horsepox or contagious pustular dermatitis. This is contagious disease which is characterized by the development of pustules, particularly in the area of the skin that comes in contact with the hairness. हेयरनस जो वो जैन होती है घोड़े की, वो जो गद्दी काठी जो होती है उसको कहते हैं, जो वो स्किन के साथ इन कांटेक्ट होती है, पर हैप्स वहाँ पे कंटिन्यूस वो इरिटेशन होती है, तो स्किन में भी स्मॉल इंजरीज या ट्रॉमाज होता है, तो इसकी वजह से वो वाली स्किन एरिया जो है that becomes more fragile or more prone to this infection. Again, this contagious acne is caused by Corynebacterium pseudotuberculosis. We have already described what is Corynebacterium pseudotuberculosis. The spread of this disease, it may occur from animal to animal through direct contact or through indirect contact. And again, the contaminated grooming equipments, grooming utensils, or the contaminated hairness, that can be the source of the spread of contagious acne. And the skin infections, particularly this seborrhea or folliculitis, it may act as a predisposing cause of contagious acne in horses. Again, unhygienic conditions that occur as a result of insufficient grooming, that may also contribute towards the development of this disease. This disease is not very much a common disease, and occasional cases they may be reported, and the disease is limited, and it does not pose much harm to the animal, like ulcerative lymphangitis. This may not cause mortality, but it may temporarily affect the performance of the horse. In pathogenesis, initially infection starts from the hair follicles, that results into the suppuration in the local area, and that will lead to formation of pustules. These pustules, when they mature, they rupture, and the fluid, the pus oozes out from these lesions that drain out, that contaminate the surrounding skin area, and hence lead to further spread of the lesions. It's occasionally, rarely, that these lesions they are superficial, and rarely these lesions they penetrate deep into the skin and develop into indolent ulcers. Clinical signs, most of the times the lesions, the pustules, the lesions, they develop in groups in an area which come in contact with the hairness, and the lesion, they initially start as a papule, circumscribed elevated hard area on the skin, and later on this papule is converted into the pustule, that is the pus containing lesion, and the size of these pustules, that may be 1 to 2.5 centimeter. Animal does not feel any irritation or any pruritus, but when we palpate or when we touch the lesion, animal may feel pain, and when the pustules they rupture, the cheesy material come out, and there is a formation of crust, and ultimately the lesion heal. It may take up to 1 week for healing of the lesions. There is a possibility of other crops of the lesions that may develop, and if so, successive crops of lesions they develop, that then the disease it may persist for extended period of time, maybe 4 weeks or even more. Diagnosis, we can diagnose the condition contagious acne only by isolation of pseudotuberculosis, Corynebacterium pseudotuberculosis from the lesions to again the fluid from the lesion that is useful for the useful specimen for the isolation and identification. Other diseases caused by Corynebacterium pseudotuberculosis, contagious acne के लिए भी पेंसिलिन दैट इज़ द डॉग ऑफ चॉइस जिसको हम दे सकते हैं या पोटेंशिएटेड सल्फोनामाइड्स दे कैन बी यूज्ड but in Corynebacterium pseudotuberculosis infection, antibiotic therapy may not be very much successful, and the reason for failure may be the intracellular nature of the organism and inability of the antibiotics to reach adequate levels on the in the cells, in the tissues. Alternate options could be the rifampicin or erythromycin that may have a bit more penetration power within the cells, that may be more effective. In addition to antibiotics, analgesics or anti-inflammatory drugs, they may also be recommended for temporary relief from pain or irritation, and local treatment of ruptured lesions with the help of some good antiseptic like pyodine, tincture iodine, that may help also help. Thank you very much.